Hey everybody, it's day five post-surgery. Um, I had ACDF surgery on Tuesday of this week. That was March 22nd at Duke Hospital, Duke University. Well, it was Duke Regional Hospital, which is all part of the Duke Medical Complex there. And the surgery took about 3.5 hours from what I understood. The surgeon, the surgical team, the nursing team, everybody has been top-notch and excellent. I'm so happy that I got this surgery done. It's something that I was probably going to need to have done at some point. And the doctor actually ended up doing a little bit more than he had anticipated. So basically, ACDF stands for anterior, which means they have to go through the front of the neck, or they go through the front. C stands for cervical, anything you're doing with the spine, so AC. D is discectomy, where they have to go in and they do some stuff with the vertebrae, cleaning out all the bad stuff, any compression or collapsed discs, and then inserting a bone graft in there. And then that's the discectomy part. And then the fusion part is that over time, my natural bone structure will grow around that bone graft and make it a much stronger structure. So I had surgery, spinal surgery in 2016 to relieve some of the pressure, the compression that I had on my neck. And because I was having muscle weakness in my left arm, some loss of motor function. I could still use the arm, below the elbow, everything was perfectly fine, but bicep, tricep stuff was basically non-existent. And but that surgery in 2016 did not help, and it seemed to make matters worse. And I thought it made matters worse because they had to go through the back and they cut you, and the recovery time was a lot more complicated. As it turns out, it did in fact make matters worse, because when the doctor who did my surgery, Dr. Barr at Duke, did the surgery, he called Ginger in the middle of the surgery and said, we were only going to do 3 levels. I need to do 4th level, partly because we noticed some droop in his neck area as a result of the past surgery, because there was no fusion done at that time. A fusion is where they put plates on either side, and then they put titanium screws and titanium plates. And also, he said, I can see where there was some damage from the last surgery. I can actually see it. There's scarring in there. So we're going to open up the discs in there, and that'll give the nerves opportunity to move around. We're not going to mess too much around with the scarring, so whether I get full function back is still yet to be decided, or determined, I should say. And when you're talking about nerves, it just takes a while anyway, so I'm going to be patient with it. Bottom line, though, is I needed to have my neck structure strengthened, and even if I don't get full use of the arm back, the fact that I have a stronger neck structure makes me feel better, and so that's good. I think that was about it as far as the surgery. So yeah, I was in the hospital from Tuesday until Thursday afternoon. So we got home Thursday night. Friday was the first full day, and honestly, I haven't really been experiencing any major pain as a direct result of the surgery. None at all. I mean, my muscles in my neck are a little bit tight, but they tell you to put ice on that. I've been doing that. I've been taking muscle relaxer, which is part of the treatment process. I really haven't been using the heavy steroid stuff, the heavy narcotics they give you all that much. I've used it just to sleep, and if I overdo it, I'll take some of that oxy, but I don't think I've taken any for the last 2 days. Did I take one? I think I took one yesterday to sleep, but that was it. Swallowing is a little bit difficult, because when they go in, they have to move things around in order to get to the area. And so I'm going to show you the scar in a minute here, but the reason the scar looks the way it looks is because the surgeon had to go in and do something extra. And there was a reason. He gave me a reason and a rationale why the scar looks different than maybe some other scars that you might have seen if you follow this at all. So the only discomfort that I've had really has nothing to do with the surgery. it's all about the allergies. This is pollen season here in North Carolina, and the pollen is in like full bore. So as soon as I came out of the hospital, I got in the car, my eyes were watering, my throat was itchy. And so I have postnasal drip, and so I'm trying to get myself comfortable to sleep, and you got the allergy thing going on, and it's draining, and I'm coughing, and I'm gagging, and it's already difficult to breathe, to swallow to begin with, so I'm swallowing a lot, and if you don't take care of that, then you end up getting a real sore throat. So what I feel from the surgery is, they say that you'll feel like you have a sore throat. No, that's not the feeling. Your throat is sore. The feeling that you would experience from a sore throat is a scratchy, irritated feeling. They move stuff around. You understand what I'm saying? They move stuff, right? They jacked you up. So things got to settle back to normal. So the things they moved aren't used to that, so it's sore. So when you swallow, it's sore. It's not a sore throat like the traditional sore throat. But some of the traditional remedies do help psychologically. Throat lozenges, I've been doing that. I've been drinking warm beverages, helps. I've been eating pretty much soft foods, but I've been eating solid foods since day one. The night of the surgery, I had a full meal, man. So it's like, yeah, go to town with it. I have to go slow and take small bites because I'm a gulper too, so that doesn't help. So a couple of times I've bit off more than I could chew, so to speak, and I had to slow down and remind myself, hey, you need to slow down. So, but once I do that, that's okay. But I told Ginger that I'm going to stick with as smooth a diet as I can, soft as I can, because it just takes forever to get through a meal. So, but neighbors have been great. They've been cooking for me, and had a great quiche and some soup and stuff like that from the neighbors. So that's all been really wonderful. So the difficulty you see me having right now is because I have the collar on and I have the allergy stuff going on. So I'm going to show you the collar real quick. I want to keep this video really short here if I can, so it's long enough to send you. Let's see here. Nope, don't want to take, is that the one? Oh, this collar here, I have to wear this collar when I'm up moving around. For about 6 weeks is the anticipated timeline. If I'm sleeping or if I'm sitting in a lounge chair, I don't have to wear it. And if I'm moving from the sink to the shower, there's no big deal there either. So it's mainly just to, it's mainly just to remind me to keep my head straight, and to also act as a reminder to people or a warning to people to stay away and not grab onto me. So you can see it looks pretty long right now. That's going to get short. That's going to get shorter, and it's going to get narrower. Right now, what you see is a lot of puffiness, a lot of redness. There's probably still some blood on there because I can't really clean it. This whole area is just kind of numb right now. It doesn't hurt at all. And this scar is going to shrink down, so it's definitely going to be below my necktie line. I can wear a nice, what do you call it? A mock turtleneck or whatever it is. This is all puffiness right here. These are going to heal on their own. There's no stitches that have to be removed. The stitches are actually on the inside, and they will dissolve on their own. So I guess he put a kind of a glue over it. I don't think it looks all that bad. Normally they try to blend it right in with your natural neckline, but he said that because of the damage that was caused because of the previous surgery, and that he had to get in there and he had to open that up, and also what he did was I already had some droop in my neck that I think I know the symptoms that were manifesting that. But he went and straightened it. So he straightened it out, so he gave me a much better neck structure. And if this is what I have to pay for that, I got no problem with it, So it's like I'm not going to be vain. I'm going to deal with it. It is what it is, and it's a good conversation point. So But yeah, all in all, I'm feeling good. I just have to remind myself to slow down and not do too much and not jump around. And Ginger's on me, to slow down. Don't, don't overdo it. And I have a couple of times, and I paid the price for it. I do feel the nerves are tingling, like they want to wake up. That's going to take some time, but prognosis is good, everybody. So thank you for all your support. I'll report in from time to time. This was day 5. Yay, day 5. Woohoo!